Hi, I'm Dr. Ash Dutta. I'm a cosmetic surgeon at the Aesthetic Beauty Center. Vaser is a mechanism by which ultrasound is sent to break the fat before we suck it out. Ultrasound-guided liposuction has been available for quite some time, but the Vaser is a refined way of doing it because of the probes that we have now brought out and also the techniques that we have developed to make it a much more successful patient outcome. Say, for example, when we are doing Vaser, we can alter the energy delivery into the patient's skin or under the skin. The ones that has got less number of rings will deliver the energy much more in line with the laser probe, and the surrounding energy or the energy that is dissipated to the surrounding area is slightly restricted. Similarly, with the ones that are more rings, the energy is less in the direction of the Vaser probe, but the surrounding energy is more, so you can break even more fat. And ultimately, when the fat is broken down, we suck it out and give the patient the shape that he or she requires. Energy-assisted liposuction, or EAL as it is known, has been available probably since 2006 or 2007. We started off with laser-assisted liposuction or smart lipo. There is another name for it also, it's called laser lipolysis. Then came Vaser, then came BodyTite, which is radiofrequency assisted liposuction. Then there is also the WaterJet, which is water assisted liposuction, and a couple of others. But it seems like Vaser has caught the imagination of patients, and it does have the capacity to break the fat in a much more efficient way. With Vaser, we can break down the small pockets of fat and create a much more defined look. In men, particularly with muscular physique, the light and the dark, the shadows show much better when we look at the definition of the muscles. Say, for example, a man's six-pack. We can create those lines with the Vaser by removing the fat along the grooves, and that gives a much more physical or a muscular look. We also have to be gender specific. That means in ladies, however slim or however toned their body is, the six-pack sort of appearance on a lady doesn't look very nice. So we have to make sure that we let the curves and the shadows play on individual bodies, and we make it very specific to what the patients need or desires, and also the gender specific body features. When we do any type of body sculpting, the amount of fat we remove, those fat cells that has been removed will never come back. However, fat cells are storage cells. So whenever our body wants to store some fat, that fat will still go into the cells that are remaining. If we think that we are going to have this one procedure and we're going to look like that for the rest of our lives, that isn't true. We have to still maintain our diet, exercise, to maintain the physique that we have desired and created with the Vaser or any of the other body sculpting procedures. We have seen again and again that people have not maintained their weight after the procedure, and what we find is the fat will still collect in those areas, but not as much as what the other areas will collect. Like any surgical procedure or even non-surgical procedures, all treatments that we do have some side effects or complications. Now, the possible complications are bruising, swelling, infection, hematoma, which is collection of blood, irregularities, etc. But with Vaser, what we find, because we can break the fat down in a much more efficient way, the other side effects are slightly less. The trauma to the body when we are trying to remove the fat is significantly less, and because we are breaking the fat up, the size of the cannulas that we use are so much more thinner than what we used to use in traditional liposuction. But at the end of the day, it is a procedure, and we have to remember the side effects may happen. It also depends on the experience of the surgeon, and of course how many procedures they have done and what sort of training background they have. Taking all these into account, we still feel that Vaser is one of the safer modalities of removing fat.